Hi everyone, my name is Dr. Dennis Barley and I'm here at Barley Wellness to talk about athletes. We take care of all type of athletes here at Barley Wellness. From a structural framework, we look at the injured site. So let me talk about what happens when someone comes in with an injury from a sporting event. If that joint is an ankle or a knee or a shoulder or a hip or even the spine, wrist or elbow, we will do a consultation, find out the mechanism of injury, find out how that injury occurred, and then do a thorough examination, not only on the site of injury. Let's say we injured our wrist. We not only do the wrist itself, examine the wrist itself, but we would also examine what we call the kinetic chain, meaning the muscles and bones and nerves that go all the way down to the wrist. So we'd even start up at the neck and take a look and see if there are any subluxations or irritations to the nerve roots that may be causing a deficit in a muscle, so that muscle no longer functions at its optimal, so that then that muscle develops a strain or or a weakness, and we address it there. Many of the treatments that we use here, we have a multitude of treatments, and today what I'm going to talk about specifically at Barley Wellness is that if we suspect a fracture, then we will take x-rays. We have digital x-rays here on site. After that examination and x-rays, if everything looks okay to begin treatment, then we'll start treating the athlete. Today I'm going to talk about ligamentous sprains. Now, a lot of people are confused about what a sprain is compared to what a muscle strain is. So a ligamentous sprain is when the tissue that holds two bones or the joint together is damaged in some fashion. The ligament is a sprain of a ligament. They're tough bands of fibrous tissue that connect two bones together, and the most common location for a sprain typically is the ankle. And the immediate mnemonic that you use for taking care of an ankle is RICE: rest, ice, compression, and elevation, to get the edema and swelling out of that area. Some people say price, for where you protect the area. So if I sprained a shoulder or an elbow, then I may put it in a sling and create protection, or a brace. A ligamentous strain, there are 3 grades to those sprains. Grade 1 is a mild sprain. It can be successfully treated at home with ice and rest. What's happened there is there's a little bit of stretching of the ligament. In the grade 2 sprain, there's more than just a stretching, but there is some tearing of ligamentous tissue. And in the grade 3 sprain, there is full tearing of ligamentous tissue. Many times that will require surgical intervention, not always, but many times, because you never want to let a sprain go if you don't treat an ankle correctly, or a joint that's been sprained correctly. What's happened there is those two bones have been shifted out of alignment, let's say. The ligamentous tissue stretches, or it tears. A couple of those fibers tear. What we've got left in here, in between, is a grade B or C material as opposed to the ligamentous tissue. Now I'm using my hands to illustrate that fact. And why it's important to realign the joints of, let's say, an ankle or a knee, is so that tissue can heal with grade A material as best it can. So how can you tell whether you've got a grade 1 sprain, which is just, you've hurt yourself, let's say running, and you twisted an ankle off of a curb, let's just say, or you were playing soccer and you twisted the ankle. A mild sprain, again, that grade 1 sprain is just There'll be some tenderness, there'll be some swelling, some stiffness, and the ankle feels stable enough, and it's usually possible to walk with minimal pain. A grade 2, on the other hand, is more severe. It's not a full tear, but it's an incomplete tear. It's moderate pain, swelling, bruising, inability to walk with a normal gait is generally what we see, and that patient may need crutches and bracing or taping, etc. A grade 3, again, we probably would x-ray to determine, differentially diagnose if there's a fracture in the area, and then refer them out for medical intervention. And again, if this ligamentous tissue doesn't heal exactly where it should, that joint becomes stable, and an unstable joint over time wears and tears, and we can have degenerative effects, degenerative arthritis down the road. There are 4 types of knee sprains that occur. There's a medial collateral ligament sprain. The medial collateral ligament is on the inside of the knee, and the anterior cruciate ligament. It's called a cruciate ligament because it's X-shaped. We have a lot of injuries in sports, especially female athletes. In soccer, they'll have a lot of ACL or anterior cruciate ligament issues. There are some posterior cruciate ligament, and that can also get injured, but it's less common than the ACL. And then the lateral collateral ligament, which is on the outside of the knee. So you can sprain those, or unfortunately you can tear those and have to have some sort of intervention, medically, typically surgical. There are 2 types of ankle sprains, and basically there's an eversion sprain, which occurs when the ankle rolls outward and it tears the inside or the deltoid ligament of the ankle. So on the inside of the ankle, the ankle turns out and causes a deltoid ligament tear or irritation or a sprain. And then the inversion, again, inversion means that the twist the foot inward, the ankle rolls. So those are very much more common. A lot of times you're tearing the anterior talofibular ligament, the calcaneofibular ligament, and the posterior talofibular ligament, or you're spraining those ligaments. Very common. Typically, that's on the outside of the leg. And the inversion means that the heel has gone in. Eversion, ankle sprain, means that the heel has gone outward. So, what is the difference between a sprain and a strain? A sprain injures the bands of tissues that connect 2 bones together, while a strain, which is a muscular, okay, remember, sprain is ligamentous, strain is muscular, can involve the belly of the muscle or the tendons of the muscle. The belly of the muscle, if I were to take the biceps muscle, and we have that big mound here, is not so big on me, but that big mound here is called the bicep muscle, and the tendon attaches in here and attaches up here. So those are 2 tendinous attachments to the muscle. If you have any straining of that muscle, where you've strained some fibers of that muscle, that could be a grade 1 or a mild damage to the individual muscle fibers. Typically less than 5% of those fibers, and it causes minimal loss of strength. A grade 2 is more extensive. We've torn more fibers. We maybe have real difficulty using that bicep muscle. And of course, a grade 3 is when the tendon or the muscle has been fully ruptured, and that is not a good thing. You may have heard of tennis players who have an Achilles tendon rupture while they're playing tennis. Feels like they had a gunshot to the back of their calf, and all of a sudden they recognize that their Achilles tendon is not functional, and that requires surgery. So the treatment for both ligament sprains and muscle strains is that we, again, we'll assess what's happened. We'll learn the mechanism of injury through the consultation with you. We'll do an examination, and again, keying in on not just the injured area, but the kinetic chain, those joints above and below that injured area, and the nerve innervation from the spine to that area. And then if there's severe enough sprain, we may take an x-ray. One of those sprains I mentioned, the eversion sprain, where it sprains the inside, tears the inside, the deltoid ligament. There is a bone down here called the fibula, and many times when that eversion sprain occurs, that fibula at the bottom cracks and we have a fracture there. So we'll do our x-rays with our digital x-ray and see if there's any fractures. And if there is, we'll refer you out to the proper medical professional. And if there isn't, then we will start the rehabilitative process. And again, both injuries acutely require, inflammation, so that price, we want to protect that area. We want to rest the area, so we're not going to go out and work out. We're going to ice that area. We're going to use maybe a brace or tape or something to compress that area, and then also elevate it to get the fluid and edema out of that area. And eventually, over time, then what we start to do is range of motion exercises. We can start then after a few days, start applying heat if need be, if the muscle requires that. The treatments that we do here at Barley Wellness would be adjustments to the area where the nerves come out for that injured site. If we've injured a shoulder, or we've injured an elbow or a wrist, we're going to check the upper thoracic and neck area, so the upper back and the neck area, to see if those nerves are functioning into that area. If there's a sprain or a strain there, we want to make sure that the muscles are getting the proper nerve innervation, so we're going to check that area. We're also going to check, again, as I explained before, the alignment of those joints. Because again, if they're out of alignment because you've sprained something, those gaps in between my fingers, they will fill in with a lesser grade of ligamentous tissue or muscular tissue, and so we try to put alignment back as much as we can. We also use physical therapeutics. In some cases, we may need to use some ultrasound or electrical stimulation being applied to the muscles of the injured area. We will teach you also how to tape, or we'll tape and support the area. We may use splints and braces and slings. We might recommend that you wear one just to keep that injured joint rested. We do soft tissue instrument assisted manipulation. Utilizing an instrument, we reduce myofascial adhesions. Myofascia is the envelope or tissue around a muscle that sometimes itself gets very tight or twisted, and we have to use this special tool to break down some of the adhesions in the myofascia, and that also then can help improve muscle function and improve athletic performance. Again, cryotherapy is simply a fancy word for using ice. We'll utilize that. We will eventually give therapeutic exercises initially to improve range of motion, and then eventually to improve strength in the area. We'll not only work on concentric, or your typical lifting a dumbbell with a weight, but we also work on the downward or eccentric activity to strengthen and stabilize that joint's area. So not only are we concentrating on bringing the weight up, we're going slow through the eccentric motion to help those opposing antagonistic muscles. And then we also have infrared sauna, amongst other things. We have some infrared sauna, which is a type of sauna that uses light for heat. A regular sauna uses warmth, heat to warm the air, but this sauna uses infrared. It's a light source, and there have been shown some great results for that. And as far as for joint injuries or ligamentous sprains and strains down the road after the acute phase, we can utilize that to relax and improve mitochondrial function in the muscle. So, common conditions that we treat with athletes at Barley Wellness. I'm just going to talk about, three common injuries that you may know of. One being plantar fasciitis. Plantar fasciitis is one of the most common causes of heel pain, and many times it involves the inflammation of a thick band underneath the foot. So there's this band that goes from the Achilles tendon over here, right? I'm using my hand, but across the bottom, and that plantar fascia can become tight, can be extremely painful. It can be in both feet, but typically it's usually in one, and you have this searing, stabbing pain as soon as you get up in the morning and taking your first few steps. As you move along and take more steps, it will tend to loosen up a bit, but it can be quite distracting and last quite a long time. So at Barley Wellness, what do we do for plantar fasciitis? Again, we're looking at adjustments. So because plantar fasciitis occurs in the heels or in the bottom of the foot, we will look to the low back to see how the nerve innervation there is working. Do you have any subluxated vertebrae in the low back or the hip or the pelvis that is causing an issue? So we'll definitely look there to see if there are any adjustments that need to be done. We will look again at the kinetic chain. So what am I talking about? I'm talking about not just that foot, but we'll look to the lower back, the pelvis, the hip, the knee, the ankle, and the foot to see if there's anything out of alignment there. So we keep that kinetic chain moving. Also, when we do adjustments to those joints, we excite the Golgi tendai apparati, big fancy word, which is around the joints that actually stimulate a response to correct neuro input into those joints and in the muscles surrounding those joints. We do physical therapeutics. We may have to do to the muscles that were injured in that area, general area, some electrical stimulation or ultrasound. And then night splints. For the plantar fasciitis, we have a night splint that we use. It'll be put on your foot. It brings the foot back into what we call dorsiflexion. Okay, and as this foot comes back, we're stretching the posterior muscles of your lower leg. The two posterior muscles that have a big effect on the Achilles tendon and the plantar fascia are the gastrocnemius muscle, which is the big fleshy one you see in the back of somebody's leg. But then there's a one that sits closer to the bone and is kind of flat, and it's called the soleus. And that muscle also is innervated, and there's two different stretches that you'll need to do. You'll need to do a gastrocnemius stretch and a soleus stretch to help this problem along, and we'll show you how to do that. Orthotics, sometimes people require orthotics in their shoes or some sort of fix in their shoe because their arch is flattening, and look what happens when my arch flattens. And this happens naturally as we age anyway, but as the arch flattens, this band that goes from here, the heel, to the toes is going to tighten and cause irritation. So we may have to use some sort of orthotic eventually, not in every case, but maybe sometimes. And then there's soft tissue instrument assisted mobilization. Again, that's that fascia we're talking about. So we may use that tool on the fascia to break up any adhesions. I've been an athlete my whole life, and I have quite a few on my left plantar fascia. I've got quite a few adhesions that I work through many times. Cryotherapy, fancy word for putting cold on it. We do that initially to reduce swelling, reduce edema. We'll give therapeutic exercises initially to increase range of motion, and then as the patient is responding, we will then do exercises to strengthen that area. And as I've said before, we use infrared sauna to improve muscle, mitochondrial function and other muscle relaxation to help the athlete heal. Two other conditions I'll just briefly touch on. Golfer's elbow. and tennis elbow. We'll start here with golfer's elbow. Golfer's elbow is a condition that causes pain where the tendons of your forearm muscle attach to the bony bump on the inside of your elbow. These tendons come in here, and this can occur in golfers, but can also occur in any athlete, quite frankly, any racket sport or weightlifting or throwing sport or repetitive motion at work or what have you can bring about a golfer's elbow. This is also known as medial epicondylitis. It just means inflammation of the medial epicondyle. It's also causing damage to the muscles and the tendons of the hands and the wrist. So we not only have to pay attention here, but we have to pay attention here and actually here and to the nerve roots here that innervate all of these muscles. You can take steps to prevent a golfer's elbow by strengthening your forearms first, using light weights or squeezing a tennis ball. Even simple exercises can help you build muscle here so that you don't cause an irritation to a tendon. How a tendon gets irritated mostly is when the muscle, the belly of the muscle, balls up and causes irritation where the tendon inserts into the bone. You want to do stretches before your activity, and you want to fix your form when you're golfing so that you're making sure that your form is good and you're not tweaking out your elbow, your wrist when you're playing golf. Use the right equipment. If you're using older golfing irons, consider upgrading to a lighter graphite clubs. If you play tennis, make sure your racket fits you. A racket that has a small grip or heavy head may increase the risk of an elbow problem, and we're going to talk about tennis elbow in a minute. Make sure you're lifting properly, including your free weights, especially bicep curls. That's where you can develop these tendon issues here in the elbow. And know when to rest. If you've overused your elbow or what have you, you definitely want to take a break. The last thing we'll talk about today is tennis elbow, and that's lateral epicondylitis. So that's if you're facing forward like this, that's over here. That's this area right here, and it can be very painful, and all the tendons here from these muscles here innervate into this condyle and causes irritation and inflammation. Shaking hands can be painful when you have tennis elbow or lateral epicondylitis. Turning a doorknob, holding a cup of coffee, lifting a jug of milk. Again, the treatment is always tailored to the patient in the severity of the condition. But again, at Barley Wellness, what we do is we have, as I've mentioned before, adjustments and checking out the entire kinetic chain. Okay. And starting at the spine all the way down and all the way back up. Physical therapeutics if necessary. Sometimes just massage or work on it. We'll show you at-home exercise and massage to do. We sometimes can use a night splint on our wrists so that we don't overdo it. We have this brace called the 𝒊𝒕'𝒔 brace. It's a band that goes around here, stabilizes the tendon so that the muscles can be used without irritating that tendon any further. We can do soft tissue instrument assisted mobilization, therapeutic exercises, cryotherapy on the area, and any other forms of therapy, exercise therapeutics that we can utilize to help you, the athlete, get in shape and healthy sooner. We also spend a lot of time with athletes on nutrition and the proper nutrition to give their bodies the best chance of performing at their best. Again, there's set amounts of protein that everyone requires. There are macronutrients, your protein, your fat, and your carbohydrates. And there are macronutrient recommended daily allowances for fat and proteins, and we advise upon that. We also advise upon what healthy carbohydrates you should be taking and what, if any, mineral supplementation you need to take also. Because the micronutrients, your vitamins and minerals are vitally important to the athlete, as well as hydration. So thanks. We'll talk to you soon, and take care.